Thank you for joining me again on my YouTube channel. With the confusion that's been prevalent, people really don't know who they should be seeing when it comes to aspects of mental health. They believe that psychiatrists, psychologists, and psychotherapists are synonyms. They're not. They're exclusive, independent entities in the field of mental health. Obviously, as a layperson, you wouldn't know exactly the difference between the three. So today, I'm trying to educate you and inform you as to the distinctive differences between a psychologist, a psychiatrist, and a psychotherapist. So let's start with a psychologist. There are many fields of psychology: social psychology, industrial psychology, educational psychology, and clinical psychology. We are really not interested in the first three because if you reach out for emotional and mental wellness, more often than not, you will seek out a clinical psychologist. Every psychologist, by the way, has a master's or a PhD degree. A clinical psychologist has had his or her training in a hospital setting. In our field of practice, we usually do not refer to people who come to us as patients, but as clients. So a clinical psychologist uses psychometric tests and with the skill of his observation is basically a diagnostician. He will be able to determine what difficulty, what issues, what mental health aspects of life you could benefit with. So when you seek a clinical psychologist, he may possibly give you some psychometric tests, possibly a Rorschach in-plot, which is a projective technique, an IQ test if he needs to check whether there are any elements of certain difficulties you may have in intelligence, a paper pencil test in terms of personality testing and personality questionnaires. He, on the basis of his assessments of what you answer, will make a kind of a diagnostic evaluation of what you possibly suffer from. That's the role of a clinical psychologist. Every clinical psychologist is not necessarily a trained therapist. That means if he has not been trained in therapy, his work stops here. He is now only able to make a diagnosis. Now he will need to refer you. If he feels that you have a medical condition, whether he needs to send you to a psychotherapist or a psychiatrist. A psychotherapist is a person who has been trained in emotional aspects of education. There are 330 schools of psychotherapy. Okay, take for example me. I am a clinical psychologist, but over and above that, I've had professional training in rational emotive behavior therapy. As an associate fellow and supervisor of the Albert Ellis Institute, New York City, I am trained in helping people reconstruct the faulty attitudes that are coming in their way of health and happiness. So once a clinician has diagnosed your problem as attitudinal, by and large, if he is not trained in therapy, he will send you to a person like me, a trained psychotherapist. Through therapy settings and through therapy processes, we will be able to address what are the faulty attitudes that are coming in your way, and we will be able to help you to correct those attitudes. Not every clinician is necessarily a trained therapist, but every therapist by and large has definitely had a master's or a PhD in one of the fields of psychology. Now let's come to a psychiatrist. A psychiatrist is a medical doctor. He is a medical practitioner who has first earned an MBBS degree. Post that, he seeks out either an MD degree in psychiatric medicine, that is Doctor of Medicine, or he prefers to go out and get a diploma in psychiatric medicine. He believes that the cause of emotional distress is largely chemical. That means there's something in the brain in terms of the chemicals in the brain which are not being released in correct order or in correct amount, which is causing you to feel the way you do. His entire model of treatment is prescription based, and sometimes if the cases are too severe, even he could resort to electroconvulsive therapy, that is in simple terms called ECTs. Not everyone needs ECTs, and of course not everyone needs the pharmacotherapy approach either. A psychiatrist believes that by giving you certain antipsychotic, antidepressants, anti-anxiety medication, the chemical imbalance which is the cause of your difficulty will be corrected, and after that, having got that in balance, you will be able to go out and live the life that you desire. So these are three distinctive categories. Not every psychiatrist is a trained therapist. A psychiatrist will usually only use the medical model of treatment. But as I said, not everyone needs medicines for simple day-to-day difficulties that they face. A psychotherapist is not qualified to give medication. So sometimes both may need to work in tandem together to be able to support you to go out and live happily and healthily. So that means, as a therapist, if I judge my therapy sessions are not really working well enough, I may reach out to a psychiatrist to support you medically, and then both of us can work in tandem and take you to the life that you aspire for and the life that you desire. That brings me to another aspect. Counseling and psychotherapy are nothing but synonyms. But being self-style counselors who've done short-term courses of 6 months and sometimes 1 or 2 years, they go out and possibly do more damage than help. Please do your due diligence. Seek out the qualifications of the therapist you are reaching out for. A psychotherapist would have had years of training under supervision and would definitely be a licensed person. I hope today's episode has helped you clear your doubts about the distinctive differences between a psychologist, a psychiatrist, and a psychotherapist. Of course, if you have any questions, please feel free to reach out to me so that I could answer them. And by the way, in fact, next episode is a Q&A with Dear Varkha. So please write in and ask as many questions that you may want answered. Until then, tune in and see me again next week on YouTube.